Pakpakan na po ang BISU. Let me congratulate BISU for this milestone that our university has achieved, another feather on our cap as a higher educational institution, the only state university, in fact, of the province of Bohol. Let me also remind everyone that BISU's existence from our transition gikan sa pagka-CBSCAF State College to a BISU University was really intended to support the provincial leaders of the province of Bohol in terms of the strategic directions of development of the entire province of Bohol. Take note, when we transitioned from a college to a university, we had bigger dreams for BISU because we thought that BISU, in complementation with the private colleges and universities in the province, can provide the future workforce that will support the growth and development of the province. On top of the agenda is healthcare. And when we talk about health, education, agriculture, tourism, infrastructure, information technology, we need workers in the Boholano workforce and the Boholano population who should have a very strong healthcare system. So the reason why we really thought of coming up with the Bohol Island State University School of Medicine was number one, we wanted to support the provincial agenda of strengthening the healthcare system of the province of Bohol. Reality is, many of our medical practitioners are not from Bohol, because we lack doctors and we lack medical practitioners here. Number two, because our schools of medicine are not here in the province of Bohol. They're in Cebu, they're in Manila, they're in Davao. Yet, we have so many Boholano talents among our graduates who can really be qualified medical students and medical doctors, but they do not have the opportunity to study medicine, especially those coming from the low-income bracket of our community, in spite of the fact that they have the talent. The other thing is, we also realize that to be able to strengthen the healthcare system, we need an apex referral hospital, so that our hospitals in the districts run by the provincial government can refer patients that are not anymore within the level of the competencies of the different hospitals. For example, in the towns and the municipalities, we tried to open up a bigger, expanded the Galeares Hospital. So we now have Tagbilaran City campus of the Galeares Hospital, and we are now also building a new campus for the multi-specialty medical center in Cortez. With the collaboration of BISU, the University of Bohol president, and the president also of Holy Name University, and the Governor Celestino Galeares Memorial Hospital through the Chief of Hospital, it was envisioned that BISU School of Medicine was really very necessary so that we can supply also the medical doctors and future consultants that will be serving the multi-specialty medical complex. Republic Act 11833, which we principally offered, supported by Congresswoman Totor in the House of Representatives and Congresswoman Banban, was passed into law. And this expanded our future direction of really coming up with multi-specialty medical center in Bohol. This is the first law passed in Congress for multi-specialty medical hospitals. And the other law that was passed later on, much later, is the law that will establish multi-specialty medical complex hospitals in every region. So we paved the way to the understanding of the fact that now we cannot just be at where we are. We have to move higher in our medical field because the threats of healthcare is there. The COVID was an experience which everyone would say the Philippines was not really ready to face. We do not know also when it will end, or we do not even know when and what type of challenge of healthcare will be coming in the next few years. So Bohol must be ready. Bohol, because we have people to take care of, Bohol, because with our population of 1.4 million Boholanos, we also have 1.5 million tourists coming to the province of Bohol. So our healthcare must be encompassing. We are also leading in the area of medical tourism, I hope. And this will lead to the support to the provincial government under Governor Aris and all the other LGUs in the entire province. So with that, let me thank once again BISU for taking the challenge. Honestly, we offered first the establishment of the College of Medicine to the private schools. And Holy Name and UB were saying, we are not ready, Congressman. And so finally we said, are you willing to support if we are going to push BISU to offer the School of Medicine? Dr. Pobar was very, very welcoming to the idea, and everything went on as now a history. So today, we are only stepping one step forward. We have challenges ahead, I'm sure. It will not be easy to run a medical school. There will always be some stepping stones along the way. Let's not look at them as stumbling blocks. Just like how we got the CHED support. Because CHED was really supporting us, and let me thank Chair Popoy de Vera. Pakpakan na po siya even he's not here with us. Together with our commissioners. Because they were guiding us along the way together with the regional office of BISU. So once again, CHED, thank you so much. BISU, HNU, and UB, thank you so much for making this happen. And of course, the Department of Health, Dr. Mutia, and our DOH officials from the national government, represented by Yusek Orquillo. And let me also thank our partner senators, chiefs, and Senator Angara. Senator Angara, by the way, helped us in securing 100 million for the initial operations of the BISU School of Medicine. So thank you once again. And of course, to our provincial, congressional, and local officials. To everyone, BISU is a big leap for a greater and better healthcare for the province. We will look forward to more successes and more heights of growth for our university in complementation with the private universities, because we want a Bohol that will really be strong, not only in the area of becoming a prime agricultural tourism destination or a strong balanced agri-industrial province, but a province that takes care of the environment and the health of our people. This is possible because we know how to dream, how to think, and to make our dreams realities. Thank you, welcome, and congratulations.